1 million people every year. Knowing when to have a hernia looked at is important to one's health. Here to tell us more is Dr. Emilia Genova, a board-certified general surgeon with Hartford Healthcare's medical group. Doctor, welcome.
Thank you, and thank you for having me.
Great to have you. So first, tell us about the different types of hernias that can present themselves.
So hernias are very common. It's one of the most common things that we actually see in the offices. And hernias that we see the most common are things like umbilical hernias. Those are the belly button hernias that patients have. And also hernias in the groins that we also call inguinal hernias.
All right, doctor, what are some common signs and symptoms of a hernia?
So the most common signs that a patient would feel if they have a hernia is that they have a bulging or like a mass that they feel somewhere in the body, usually on the belly, and they would have pain. And those are the signs that we see the most common.
All right. When should someone know when it's time to see a doctor?
So in general, if a patient thinks that they have a hernia, we would love them to see their primary care physician at least and discuss with them. But if, if it's not quite certain or the primary care does indeed think that they do have a hernia, we absolutely think that this patient should be seen in specialty offices, like a hernia specialist needs to evaluate them and decide what to do next.
And doctor, are hernias painful?
It could be, absolutely.
All right. What are some of the latest and most current treatment options available?
I mean, we've done hernia surgery for many, many years, and traditionally it's been done in open fashion. But in the last several years, we've made tremendous improvements in the way we deal and treat hernias. And the most common procedures we do nowadays are minimally invasive, such as laparoscopic and robotic. And myself and Dr. Dyatlov and Dr. Friedman, we all have expertise in the areas.
All right. Tell us what the recovery time is like for your patients after surgery.
Well, it's a little different for everybody, but again, with doing minimally invasive surgery, with patients having small incisions, patients do go home the same day, and they can return back to activities within the next 2 to 4 weeks with full recovery.
All right. And Dr. Hartford Healthcare has a webinar on hernias coming up. What can you tell us about that?
So myself and my partners, Dr. Dyatlov and Dr. Friedman, we're going to talk about, pretty much what you're asking, but with way more extent to discuss hernias, how we treat hernias, when hernias even need to be treated, and give recommendations on that topic.
All right. Wednesday, September 7th, Dr. Emilia Genova, general surgeon with the Hartford Healthcare Medical Group. Thank you for joining us. Good information.